it still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on is following the symptomatic cases. If we followed all of the symptomatic cases, because we know that this is a respiratory pathogen, it passes from an individual through infectious droplets. If we actually followed all of the symptomatic cases, isolated those cases, followed the contacts and quarantined those contacts, we would drastically reduce. I would love to be able to give a proportion of how much transmission we would actually stop.
The World Health Organization yesterday casting some doubt and causing some confusion about the spread of the coronavirus through asymptomatic infections. You heard a top WHO official calling asymptomatic transmission, quote, very rare, emphasizing it is not driving the spread of the virus. The new conclusion was drawn from new contact tracing data from several countries. However, preliminary evidence from the earliest outbreaks indicated the virus could spread from person-to-person contact, even if the carrier did not have symptoms. Now, the WHO says that while asymptomatic spread can occur, it is not the main way that it is being transmitted. The comments are raising questions from leading health experts. The director at the Harvard Global Health Institute has blamed the WHO for creating confusion, tweeting out that communication by the WHO is not stellar, and such a statement should be accompanied by data. He calls asymptomatic spread the, quote, Achilles heel of the outbreak. That's from Dr. Ashish Jha, who will be our guest later this morning. Questions also rising over why the agency recently changed its guidance on wearing masks. Previously, the WHO recommended only healthcare workers, people with COVID-19, and their caregivers wear medical masks. On Friday, the WHO changed its guidance and now is advising that in areas where the virus is spreading, healthy people should wear fabric masks when unable to socially distance. Okay, let's try to make some sense of all that. Joining us now, former White House advisor for health policy, professor and vice provost for global initiatives at the University of Pennsylvania, Dr. Emanuel. He is an NBC News and MSNBC medical contributor and co-host of the podcast Making the Call. Also, the author of the new book entitled Which Country Has the Best Health Care, which hits bookstores next week. Also with us, Morning Joe chief medical correspondent, Dr. Dave Campbell. Gentlemen, good morning. Good to have you both with us. Dr. Emanuel, I'll begin with you, and you can help us sort out, because I think people's heads are spinning. When the WHO says asymptomatic transmission is rare, we've been told for all these months now that part of the idea of staying at home is you could have coronavirus and not know it, and just the act of going out to a grocery store or a restaurant, you could be spreading it to people without knowing it. What did you make of the WHO comments yesterday?
Well, I think the official went overboard compared to what the actual official document, which I have here, said. So if you actually read the document carefully, it says that there are 3 studies that look at spread without symptoms. Part of the problem, and this is what they didn't make clear, is asymptomatic spread is when you never develop symptoms. You can only tell that at the very end. One of the things we know is that a lot of people are most infectious 1 to 3 days before they have symptoms. They look asymptomatic because they don't even know they have the disease, but they can still spread it. Well, they're not truly asymptomatic because they eventually develop symptoms, but they look asymptomatic. So if they were a little more careful, they would have said you can spread it when you're pre-symptomatic and then develop symptoms, and that makes it, yes, easier to trace. But people without symptoms can spread this disease. That's the important point. People who haven't developed symptoms yet, have the virus, can spread the disease, actually are most infectious, and then they can go on to develop symptoms. So we still do have to be very careful when people don't have symptoms and go out with a mask, make sure that you're staying 6 feet away, because you could have the virus, you don't know yet, and you could develop symptoms. And that is a key problem. It was a very confusing statement. True asymptomatic people, who you'll eventually know after 2 weeks, yes, they may be at low level, but by the way, the WHO statement doesn't even show that they're at low level. They show that they spread from 0% to 14%, depending upon the study. So it's not zero. So I think that was a very confusing and unhelpful statement, the way she said it. And I think she is right that contact tracing can reduce the spread. But, you've got to be a little more precise if you're going to make a major statement to the entire world about how this disease is being spread.
Yeah, Dr. Campbell, I think this is one of the many moments that Americans have had over the last 4 months where they've gone, wait a minute, what? So what does this mean for me? What do I do with this information? So asymptomatic versus pre-symptomatic, just in plain English, what's the distinction there, and what are the implications for our ability to go back out and resume businesses and resume our lives again?
Well, it has nothing to do with going back out and resuming our lives, or any change, I should say. When we speak of pre-symptomatic, it is as if we need to be clairvoyant and know that those individuals will eventually develop the symptoms of COVID-19. The most well-known ones and the severe ones are cough, fever, shortness of breath. You don't know, I don't know whether today I may be in the beginning stages of having COVID-19, not know it, and be very contagious, as Dr. Emanuel says. Those are pre-symptomatic individuals. Those that are asymptomatic may have the disease in them, the virus floating through their system, and never develop anything other than perhaps mild symptoms. So the distinction between true asymptomatic and those that are pre-symptomatic and going to get sick is key. And the speaker, Dr. Von Kerkhove, was making a point early in this process of identifying this information, and it was useful, but it was very confusing. And I think all of us had to watch her reporting a few times and then read the World Health Organization statements to try to figure out and parse out the distinction she was telling us. It was important that she was stressing over and over again that massive testing of those with symptoms is going to be the most valuable to identifying those that are likely to become secondarily infected. So it was just a little snippet of information that got us all in a tizzy yesterday, but it clearly wasn't the intention. There was something that wasn't spoken, and Dr. Emanuel, you may want to speak to this, see if I have it right. It's the viral load that also has some relationship to how contagious or infective you are. We know that right before you become very sick with a fever and a cough, the day you're going to become sick with COVID-19, you're very contagious. You have a lot of virus being shed from your respiratory system. And if the viral load turns out to be higher in those that are very sick and lower in those that are true asymptomatic, there might be an explanation for what Dr. Von Kerkhove was saying.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.